Cleft lip and palate is often a very scary diagnosis for a lot of parents, and it's a diagnosis that's made either in utero or at childbirth. And usually cleft lip and palate can affect the speech, it can affect the teeth or the dentition, and it can also affect the overall aesthetic and function of the lips and the nose. And usually for cleft lip surgery, we tend to perform those early on in childhood, so usually between 4 to 6 months of age. And then for cleft palate surgery, we do that surgery in order to improve speech outcomes for patients. So usually we perform that surgery a little bit closer to a year of age as children are a little bit older and better able to tolerate that procedure. Usually for these patients, we often require a series of surgeries in order to correct everything. And so this often can include bone grafting a little bit closer to 9 to 12 years of age, and rhinoplasty a little bit closer to skeletal maturity, so after children have already matured a bit more in teenage years. I'd say for patients with cleft lip and palates, the surgeries themselves are very safe. Often they only require at most a night's stay in the hospital. And for these patients, they can have a pretty large impact on their quality of life after these surgeries, just because they're able to restore really favorable aesthetic outcome and also improve their overall function and speech.